It's the Doctor's TMI Tuesday.
Doctor, give me the news.
Today we're solving your embarrassing medical mysteries once and for all. Like, what could cause skin to harden like shoe leather if you're only 27?
My name is Natalie. Can you guys help me figure out what this is on my knuckles? I've had it since I was about 13 years old, starting with puberty, and it's been getting worse ever since. I feel very uncomfortable texting because my knuckles are exposed. I just want to know if you guys can help me figure out what it is, how I can fix it. Please, doctors, help me.
And Dr. Lee is back with us, as well as Natalie, and Dr. Lee's assistant, Christy, joins us. So, something you've been dealing with for a long time.
Well, and Natalie is not alone because millions of people experience hyperpigmentation. What is that? A discoloration of the skin due to too much melanin. We know melanin is the pigment formed by melanocytes in the dermis of the skin. It's supposed to be evenly distributed, but typical areas that may have excess melanin deposits include the hands, the elbows, sometimes the armpits, and the feet.
So you can really see more darkening in these areas, and that's really a secondary effect to what you have. So it's bumpy on the knuckles, and actually on your palmar surface, you see it. This is called the Wallace line. This is the junction between the palmar surface and the dorsal surface of the hand. And so that helps us. This is actually the thenar eminence and the hypothenar eminence. So we see these papules that kind of coalesce into plaques in these areas and on your knuckles, and we see them on your feet, the dorsum of your feet, and also at the same Wallace line, this kind of junction between, turn this way actually, maybe you can see better, this junction between the dorsal foot, the regular kind of skin, and like your plantar skin. We're thinking really of two different things, and they're long words, okay? This is dermatology. We speak another language.
We have to let her say these big words.
Yes. One is acral keratoelastoidosis. Okay?
Right.
And the other one is focal acral hyperkeratosis. What is really interesting about these two things is that the only way you can differentiate the two is by looking at it under the microscope.
I think that's a great point for everybody out at home that so often with dermatologists, if you're confronted with something different, the only way to make that diagnosis is doing a skin sample biopsy and looking at it under the microscope.
Actually, we are going to do a biopsy now, if that's okay. I have a circle here, and we're going to do what's called a punch biopsy. And we're going to take a punch, and the reason I'm doing this is I'm going to send another biopsy out to get special stains. If we stain elastin specifically, we can more accurately see if it's fragmented or not.
And obviously you've numbed this ahead of time.
Absolutely, and she's a pro. So what I'm going to do is I'm going to take this punch. It's like a cookie cutter, we call it. And this is 4 millimeters in diameter. And all I'm going to do is I numb that area, and I'm just going to take it, and we just twist it, and it makes a little cookie cut, just like that. And now I'm going to grab a scissor and a pickup, and we're going to pick it up and put it in a biopsy bottle. So I took a punch, and all we do is we put a little stitch in it to fix it. And what you'll want to do is in about 7 to 10 days, just take this little stitch out, and you're good. All right?
All right,
Thank you. Feeling okay? You didn't feel
good.
that, right?
No, not at all.
Well, dermatologist Dr. Sandra Lee is back in the doctor's lab with histotechnologist Eric Gasson. So what have you found back there?
Well, Eric was kind enough to really slice up the tissue very thin, and you can see, here's a slide, and you can see the tissue has been laid out, sliced really thin, like almost translucent, and then he applies a dye so you get various pinks and blues so that you can look at it under the microscope. We have one of them mounted on this microscope, and if you look at the picture, the top layer is actually stratum corneum. That is the thick top layer of the skin, and that's why it looks thick and raised. Right below there is the epidermis, the very really technically the first layer of the skin. And if I scroll down below this, those blue kind of lines there are blood vessels, and that's elastic tissue and collagen dispersed in here. And really we have it narrowed down to 2 diagnoses, that being acrokeratoelastoidosis and focal acral hyperkeratosis. And really what I want to do is take another biopsy and send a piece of skin away for special stains. There are special stains to stain elastin to see whether it is, abnormal, and that will let us know whether it is one of these disorders or the other. Really, the most important thing here is that I want to give hope to her. I want to let her know that even though this is something that we can't cure, we can certainly do things to help improve the appearance of it, whether it be with skin lightening creams like hydroquinone, or topicals that try to, take down the thickness of it there a little bit, like retinoids, salicylic acid, and urea. All these sorts of things can kind of help improve this. But, there's some oral medications, but really I think that the risks really outweigh the benefits. So not a great idea, especially if they only bother her cosmetically.
Well, Eric, Dr. Lee, thank you so very much.
Thank you.
And Natalie, I know you're going to be following up as well. I want to thank all of our guests today. They got answers they needed because they weren't embarrassed to ask the question, what's going on with my body? You shouldn't either. Believe me, we as doctors, we've seen someone with problems that are so humiliating, oftentimes more humiliating than the problem you're dealing with. So maybe it's just a mysterious rash, some unexplained symptom, or an embarrassing body condition. You can't figure out what's going on. Call your physician. Talk to them about it, because a lot of times there is a solution. Those are my doctor's orders. If you want more information on anything you saw today, whether we're talking about eczema or even delayed puberty, head to thedoctorstv.com. Thank you so much for being with us.